Now, the sinusoidal membrane transporters, the NTCP and organic anion transporter along the basolateral. Apart from this, you have the bile salt export protein, MRP2, MDR1 or the ABC1, MDR3 or the ABC4. This is important. Why is it important? Because these are the ones which result in certain conditions like progressive familial intrahepatic cholestasis and benign recurrent intrahepatic cholestasis. Okay, so we have already learned your BRIC and your PFIC. These are actually two ends of the spectrum. This is your BRIC comes benign recurrent intrahepatic cholestasis, whereas PFIC, this is at the extreme end of the spectrum. So you have 1, 2, here you have 1, 2 as well as 3. So it is because of the same defect. Okay, so first the enzyme defect would be the same, but the manifestations may differ. So when you have your FIC gene mutation, which causes a phospholipid flippase abnormality, that is what results in 1 BRIC as well as type 1 of PFIC. Whereas it is your bile salt export protein where there is a defect in this that results in BRIC2 as well as PFIC2. And you have your ABC, MDR3 or ABCD4. This is what is responsible for your PFIC type 3. Okay, so these are the different transporters which have a role in biliary secretion. So in the absence of this, what happens? There is conjugated hyperbilirubinemia and cholestasis.